everyone, I am Chris Antahero Caparas from BSN 111G, and today I will perform an oral administration of medication return demonstration. Oral administration is the most common, less expensive, and most convenient route of administration for patients. In doing so, it is essential to remember and adhere to the 10 rights medication administration to avoid errors and ensure client safety and well-being. Then, the 10 rights of medication administration are included the right patient, right medication, right dosage, right time, right route, right client education, right documentation, right to refuse, right assessment, and also the right evaluation. But before conducting the procedure, the first thing to do is to check the physician's order to know what medication should be given to the assigned patient. Also check the medication administration record or MAR with the physician's order. Then, check for the drug name, dosage, frequency, route of administration, and expiration date for administering the medication. Then, so the patient need to take vitamin C for wound healing. It is needed for many functions in the body, including the helping the body use of carbohydrates, fats, and protein. Vitamin C is also strengthening blood vessels walls. Then I am going to verify the client's ability to take medication orally. Then determines whether the client can swallow, is in PO, is nauseated or vomiting, has gastric suction, or has a diminished or absent bowel sounds. Then now I am going to organize the supplies and bring the requisites to the preparation area. The requisites including is the medicine cup, the medicine tray, and if needed the stethoscope and the sphygmomanometer. Then now I am going to perform hand hygiene first to deter the spread of a microorganism. Then I am going to prepare medication for one patient at a time. Obtain the correct drug, compare name of a medication on label with EMAR or medication ticket rather, and exit ads after removing drugs. Check or calculate drug dose as necessary. Double check calculation. Check expiration date on all medications and return outdated medication to pharmacy if there are any. Then check record for medication count and compare current count with supply available, especially if in preparing a controlled substance. Read the MAR and take the appropriate medicine. Compare the label of the medication against the order on the MAR or computer printout. Now, recheck the medicine label with the MAR and also note for the expiration date. Places package unit dose, capsules, or tablets directly into the medicine cup. Do not remove the medication from the package until the bedside. If using a stock container, pour the required number into the bottle cup and then transfer the medication to the disposable cup without touching the tablets. Then Breaks only scored tablet if necessary to obtain the correct dosage. Use a cutting or splitting device if needed. Then, if the client has difficulty swallowing, check if the medication can be crushed. Then, if it is acceptable, crush the tablets or find a powder with a pill crusher. Now, for liquids or suspension, first thoroughly mix the medication, remove the cap and place it upside down on the countertop. Hold the bottle so the label is next to the palm and pour the medication away from the label. Now, place the medicine cap on a flat surface at the eye level and place the thumb on the hand on the prescribed level and read at the lower meniscus. The lower meniscus is a curve in the surface of the molecular substance when it touches another material. This is done to have an accurate reading of measurement of the liquid medicine. Now, pour the exact amount of the medication prescribed into the medicine cup. Then, wipe the bottle's rim with a paper towel before cupping the bottle. Now, for drops, using a medicine dropper, draw the amount needed of the medication and place it into the top of medicine cup. Then, wipe the bottle's rim with a paper towel before cupping the bottle. Then, places the prepared medication and MAR together on the medication cart. Then, recheck on the label and the container before returning the bottle, box, or envelope to its storage place. Then, avoid leaving prepared medication unattended. Locks the medication cart before entering the client's room. Now, check the room number against the MAR if agency policy does not allow the AMR to be removed from the medication cart. Then, place the prepared medication and MAR on the same cart and check the room number against the MAR before entering the room. Now, I am going to close the door for my patient's privacy. So, hello ma'am, good day. I am Kristen Tajero Caparas, your student nurse. And just for verification, are you Kyle Angeline Tuquinto, right?
Yes.
Okay. Can you state your birthday, please?
August 5, 2004.
Okay. So, I already closed the door, curtains, windows for my patient's privacy. So, now I am going to discuss the purpose of medication. Okay, ma'am. So, Dr. RC has prescribed you with a vitamin C. It's a generic name is ascorbic acid to be taken once a day after meals, and it is in a tablet form, which means you'll have to take it orally. It is okay with you, ma'am?
Yes.
Okay, so vitamin C is necessary for wound healing. It is needed for many functions in the body, including helping the body use carbohydrates, fats, and protein. Vitamin C also strengthens blood vessels, walls. Too much, it can cause side effects such as nausea, vomiting, headache, insomnia, and more. Okay, ma'am. So, I am going to assist you in a sitting position. Okay, are you comfortable with that position, ma'am?
Yes.
Okay, so if needed, perform the administration assessment such as taking blood pressure, pulse rate, and respiratory rate. Okay, ma'am, before I give you your medicine, I am going to check for your respiratory rate, also for your blood pressure. Okay, now, ma'am, I am going to take for your blood pressure. Okay, ma'am. Just relax. So now I am going to compare the name of medication on labels with medication tickets at the client's bedside. And if using the by using the EMAR, scan the client's barcode to verify the administration of medication, pick up the due medication and compare the labels with barcode on the drug and EMAR. So, ma'am, since you already done your breakfast, I will give you your medicine. So, give the client sufficient water or prepare juice to swallow the medication. And if the client is unable to hold the pill cup, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. Then, if an older child or adult has difficulty swallowing, ask the client to place the medication on the back of the tank before taking the water. Then, if the medication has an objectionable taste, ask the client to suck a few ice chips for her hand or give the medication with juice, applesauce, or pudding if there are no contradictions. So, if the client says that the medication you are about to give is different from the what the client has been receiving, do not give the medication without first checking the original order. Okay, thank you, ma'am. Okay, ma'am, very good. Now that you already done taking your medicine, now I am going to leave you here so that you can rest. It is okay with you, ma'am?
Yes.
Okay, thank you, ma'am. So if you do you have anything, don't hesitate to call me. Then I'll come back after a few minutes. So thank you so much, ma'am. for your cooperation. Now that I'm done with the administering of the medicine to my patient, I will proceed to the documentation process of the procedure that I have done. I am going to, the documentation will include the medication route, type, and the time is what it was given. So I have given my patient vitamin C as per the doctor's order. The vitamin C is with a generic name, which is ascorbic acid to be taken at once a day only after her meals. So also included the documentation, any complaint from the patient in the documentation, and if the medication has been refused or omitted, then also document the reason for omission. Then lastly, always remember to affix your signature on the documentation sheet, including that you have carried out the doctor's order. Then dispose of all of these supplies appropriately. Then replenishes to stack and return to the cart to the appropriate place. Discard the use disposable supplies. That's all. Thank you.